I first thought about medicine when I was a kid. I saw an advertisement in a National Geographic magazine talking about a group that went internationally to help patients with surgery. And ever since then, I decided I wanted to be a doctor. I decided I wanted to be a surgeon. Global health is something that always interested me, has interested me, and something I'm still interested in now. After I'd been accepted to medical school, I went and worked with a group in Ecuador who was doing joint replacement surgeries and orthopedic surgery for kids. When I was with that group, I realized how incredibly they were helping the patient population there. There were patients who would come in from a long bus ride who couldn't walk, patients who had to be carried by family members who had both hips or both knees replaced, and a few days later were strolling out of the hospital. It was amazing to see the change in their life that these doctors had been able to help the patients with over just a few days. From that point, I became really interested in orthopedics. I kept studying it in medical school. I went through a lot of training, and at each step, I found that I was more and more interested, more and more pleased with the specialty. Well, I see a lot of patients. I have a specialty in orthopedic sports medicine, but I will also take orthopedic call, meaning that I get to see a lot of patients who have been unfortunate enough to have a broken bone or other kind of trauma. That's something I enjoy doing, and I enjoy helping patients with these traumatic problems. So in addition to these patients from all walks of life who may have broken a hip or an ankle or a femur, I have this interest in sports medicine, meaning working with active patients and specializing in minimally invasive orthopedic surgery. I work hard on treating my patients, not necessarily their X-ray or their MRI. I talk to my patients about what they want and how we can work together to give them that. I have many patients that I get to know really well over a period of 6 weeks or 3 months or 6 months, and getting to release them back to the activities they want to is one of the best moments of my day. I always enjoy that in clinic, where I get to tell the patient, you're good to go, you have no restrictions, you can take part in whatever you want to, you've done a great job, and it's been nice to get to know you. I have a young family. I have 2 young children, and I spend a lot of time with them. We'll go swimming, we'll go hiking, we'll go to the beach. I also enjoy running myself. I go running with my dog down at the beach sometimes. I have a wonderful wife I get to spend a lot of time with, so I'm pretty focused on being with my family as much as I can.